I've had this question a couple of times. Lindsay, could you please explain to us what it means when you refer to a fat-soluble vitamin versus a water-soluble vitamin? So I'm going to explain all of that and the significance of that in this video. When we speak about nutrition and overall health, it's obvious that vitamins play pivotal roles, each having unique attributes that influence our health. These vital compounds segregate into two primary categories: fat-soluble and water-soluble vitamins. In this video, I will clarify for you which vitamins are water-soluble and which are fat-soluble. I will also explain why it is important to make this distinction when it comes to supplementation. First, we'll look at water-soluble vitamins. Water-soluble vitamins are akin to fleeting heroes. They exhibit the propensity to dissolve readily in aqueous, otherwise known as water-based solutions, when they enter our bodies. We know that there are 9 water-soluble vitamins: the B vitamins, folate, thiamine, riboflavin, niacin, pantothenic acid, biotin, vitamin B6 and vitamin B12, and vitamin C. However, there exists a caveat. For the most part, these vitamins are not stored in the body. Our organism lacks the capacity to store water-soluble vitamins for extended durations. This necessitates recurrent replenishment through diet and sometimes through supplementation. Without the frequent ingestion and consequent absorption of these water-soluble vitamins in the intestines, deficiencies and ensuing health-related repercussions can occur. For example, a deficiency in thiamine or vitamin B1 can result in a condition known as beriberi. Your body needs thiamine to break down and digest the foods you eat, to keep your metabolism going, and to help your muscles and the nervous system to do their jobs effectively. A deficiency in this vitamin leading to beriberi can affect the cardiovascular system or central nervous system, and deficiency is most often associated with alcohol use disorder, secondary to malnutrition and poor absorption of vitamins in these individuals. Moreover, deficiency of any of these water-soluble vitamins can certainly lead to clinical syndromes with some severe health implications like the one we just discussed. Water-soluble vitamins are vital for our growth, our development, skin health, nerve function, heart health, and red blood cell formation. While the overall deficiency in North America is rare, as I mentioned, it can occur in conditions like alcohol use disorder, malabsorption syndromes where a person is not able to absorb the proper nutrition from their diet, strict veganism, or malnutrition. On the other side of the spectrum, we have fat-soluble vitamins. These include vitamins A, D, E, and K. These vitamins are stored in the body, which is very different from the aqueous vitamins that are not stored. It's important to note that having a fatty meal with a fat-soluble vitamin will help to increase its absorption. They are absorbed into the small intestine as part of newly formed micelles, which are lipid clusters containing hydrophobic groups or water-fearing groups internally and hydrophilic or water-loving groups externally. This process depends on the secretion of bile and pancreatic enzymes. After absorption through the cells in the intestinal wall, these cells are known as enterocytes. Fat-soluble vitamins are packaged into something called chylomicrons, or small fat droplets, and then they're secreted into the lymphatic system. Eventually, they do enter the bloodstream. Unique characteristic of fat-soluble vitamins lies in the fact that contrary to water-soluble vitamins, fat-soluble vitamins are stored in various tissues, allowing them to be retained by the body for a more extended period compared to water-soluble vitamins. This leads us to the question of the buildup of fat-soluble vitamins and potential for toxicity. While fat-soluble vitamins provide essential functions, you need to be cautious about overconsumption. Excessive intake of these vitamins can lead to toxicity, resulting in various health issues. For example, oversupplementation or overexposure of vitamin A can lead to hypervitaminosis A, causing a range of symptoms including headaches, papilledema, seizures, skin issues, and liver damage. Another example would be vitamin D. Although rare, hypervitaminosis D can occur with excessive intake of supplements and vitamin D fortified foods, which can cause gastrointestinal problems, hypercalcemia, which is too much calcium building up in the blood, and bone and joint pain. Moving on to vitamin E. Hypervitaminosis E is also rare, but it can result from oversupplementation, and this is especially contraindicated in patients on anticoagulants, otherwise known as blood thinners, due to its ability to thin the blood, thus preventing the blood from clotting normally. Finally, vitamin K toxicity is uncommon but can happen in certain situations and lead to hemolytic anemia, jaundice, and even liver damage. Understanding the difference between fat-soluble and water-soluble vitamins is crucial for maintaining optimal health and understanding the cautions that are warranted with any kind of supplementation. It's not just about getting enough vitamins, but also ensuring a balanced intake to avoid deficiencies as well as toxicities. So, next time you reach for that vitamin supplement, remember that just because it's a vitamin doesn't mean that it doesn't have potential side effects. As always, too much of a good thing is indeed too much. I hope this was helpful. Thank you so much for joining me. Take care and stay healthy. Bye-bye.